Hello and welcome to Breaking the Cycle. My name is Alan Hyde, and today we are honored to have a repeat guest, a returning guest who did wonderful the last time she was here, Ashley Stafford, licensed clinical social worker supervisor. We'd also like to share, Breaking the Cycle. We're not just a podcast, but we are a therapy practice in Hurst, Texas. If you're relating to the information that you hear, or you're just in general struggling and looking for support, jump down to the description section. You'll be able to find all of our contact information as well as Ashley's if you relate to what she's sharing with you today. Other than that, we're glad you're here. And Ashley, we're glad you've joined us again.
Thanks for having me back.
Yeah. So you specialize in trauma.
Yeah.
And we're going to talk a little bit about that today, just kind of its applications, what it looks like. We kind of dove into that a little bit. Last time you were on, I couldn't speak, right? Because I think it was the...
Yeah, you were like...
Yeah. And I didn't know afterwards whether that was, I had laryngitis or because I was singing the Jurassic Park theme song over and over and over again. Yeah.
So loud.
Yeah. We were out where those...
Fossil Creek.
Yeah.
The dino prints.
That's right.
That's cool.
Yeah.
Dinosaurs.
So how have you been?
I've been good. I recently moved offices. So now I'm in Fort Worth off Hewlin, so kind of in that Central Market area, just because I live in Fort Worth.
Yeah.
And doing some private practice there along with my nonprofit work that I do, but refocusing on that a little bit because I continue to get referrals people with complex PTSD, people that want somebody who really specializes in trauma, who've done maybe tried just regular CBT or talk therapy and they feel like it's ineffective for them, which I think it's not going to work. So I literally moved in yesterday, and the movers were an hour and a half late.
Uh-oh.
And I had to pay my babysitter a lot of money.
Yeah.
But we're there, and there's plants everywhere, and it's a vibe.
Yeah.
So
very
I love
cool.
it. It feels like a little boho cave.
Nice. And you're just renting one space for you?
Yep,
Cool.
just my little space. It's inside Ridgely Family Guidance, which has been there forever.
Yeah.
Cheryl Dillman is the therapist that owns that, it's her space, and she was gracious enough to let me go up there. So it's cool. It's on the second floor, so there's a big window. Whoops, sorry there. Hello. Sorry. It's got big trees, which I love too. So yeah, it feels like, in therapy, well, I don't know if the work you do a calm, safe space or whatever, creating that peaceful state in your own mind. And I'm I think my therapy office is my calm, safe space. Yeah. Cause it's you just create it so perfect for the vibe that you want, you know?
Yeah.
I love it.
Yeah. It's a place where I'm going to hang out all day, every day. So
basically,
I think 5 days a week at least.
Yeah. I forgot having that own little tucked in space for myself because I've been running around the community so much the past year.
Yeah.
That it's so calming.
Oh yeah.
I was more excited than my client today. I'm look at it. And she's I can see you're really happy. I'm isn't it great? And she's yeah, I'm happy you're happy. I'm okay, I'm sorry.
Yeah.
Calm down.
Turn. Yeah.
Your turn. You talk this time.
Yeah.
So yeah, it was cool. It's cool.
The excitement is cool. When we landed this spot and being able to kind of set up the podcast, which is this unique kind of niche thing that I do with my practice. It's it's cool. Very, it's calming, but it's also exciting, and looking around okay, I set this up. This is cool.
Yeah. The ownership of it, the personal ownership of your space, it makes a difference.
I think so.
Yeah.
Yeah. So let's break down, and we'll ease into this, but how would you, to somebody who is new to the information on post-traumatic stress disorder, how would you explain that to them? Mm-hmm. How would you give kind of the non-clinical breakdown, and we can intersperse the clinical stuff, but how would you describe this to somebody who has never heard of it before?
Yeah, well, I think first of all, PTSD, when you talk about post-traumatic stress disorder, I think historically people really think of it in terms of war veterans, which is accurate. but I think it's just so much more broad than that. It can develop in so many ways. And so when I think about post-traumatic stress disorder, I'm thinking of it as like you have this distress in your body that surprises you at times that you wish it wouldn't. And usually accompanied by some type of external stressor. So like if you are continuing to have this somatic experience and somatic, that's very clinical, a feeling in your body that is oftentimes tied to images and thoughts that are like repetitive and intrusive and start to cause you distress in your life, like not being able to sleep, like avoiding certain situations consistently that you wish you wouldn't have to avoid because it upsets you so much. Nightmares, feeling like you're looking at the world through a window, like a foggy window, like just not able to connect. And I don't know if numbness is the right word, but like just a feeling of going through the motions without having like a real present sense. Like I don't really feel like I'm here, but I know I'm here. I don't really feel like I'm having a conversation with this person, but I am. Yeah. That's usually what I see with people. And then I think a lot of like unexpected, like I just had a panic attack out of nowhere. I don't know why. Why am I responding this intensely to something that other people would maybe say, well, it's just whatever. Like it's just coming into work, or it's just seeing that car over there, or it's just going home to your family.
Right.
And I think PTSD looks a lot like that. When you're going through it.
Sure. Well, it's like, and you caught yourself. I appreciate it because like what you're describing, right? You and I know it's like there are the different presentations of derealization, depersonalization, but just that sense you were talking about of like the disconnection from moments is a huge one. I think in society that most people could probably relate to at some form or another, which is also a useful tool.
Yeah.
For helping to break down, like that doesn't necessarily mean you have this diagnosis, but for those who do, this is a good way to start to maybe build that empathy away from like, well, just don't do that. It's like, well, okay,
you
but
can't help it.
Yeah. It happens.
Yeah, it literally is automatic. And I don't know. I don't think I told this story last time. I had because I love telling this story when I do trainings about like what happens in when you disassociate. Like it's so like it. So and if I already told this story, then just cut it out. I was working in the ER doing psych evals for like 4 years, for like a long time, and not just in the ER. Like I'd go to the CVICU or the ICU if someone attempted suicide and then wasn't successful, for lack of a better term, and they woke up and I'm like, hey, guess what? I think you need to go to the psych ward because you almost died from trying to kill yourself. Or if there were any like psychotic patients, it was a really fun job. It was a really fun job. At first it was really hard and really scary, but then it was like just almost like addictive, that adrenaline of like never knowing what's coming into the ER that day. And this was one of those days where this patient wasn't even my patient. But I know, and I went down there to eval another patient. There was a guy way across the room, actually in the other side of the ER. So like there's the ER, there's like the doctors in the middle that have like this open walkway, and then B side or whatever. And they were like, oh, that patient's really agitated. Like he already took an IV pole down and like swung it at the nurse. Like, we're trying to get him to go in voluntarily. The family's like, he's so psychotic. And he was a pretty big young dude. And, we were talking before we popped on about like, working in this field, you get a pretty thick skin. So like people will say, I had homicidal patients that have chased me. I've had to restrain patients. I've had people threaten my life multiple times. One guy, one time, he was really sweet though. He was having auditory hallucinations that were telling him that he was going to like cut my head off. And it was terrifying to him. Yeah. And you could just see in his eyes, he did not, like, I was not afraid of him because like he had no violent history. It was just the voices in his head. I'm like, okay, but do you want to do that? He's like, no. I'm like, well, you're not going to. Like, it's gonna, like, we're gonna help you. So, to context, like, I'm not a big baby, okay? Like, like, I'm tough. Just so everybody knows.
Yeah. Therapists are tough.
Yeah, and sensitive. So.
It sounds like a brooding teenager.
Yeah, I'm tough and sensitive. I feel like that sometimes. So had this guy, he's way across on the other side of the room, ER, and he starts running like towards what I thought was the exit, like he's gonna elope. Okay. And for anybody who doesn't know, if someone's in an emergency room, they cannot be restrained by the staff there unless it's like a crisis, right? Yeah. So if they want to run out because they don't want to stay, the only power that we had at the time was just to call the cops. So it's not like some places have their own PD. We did not. And so I'm like, oh, he's going to run out. I'm not getting in the way. Like, I'll just call the cops. So I like moved to the side, and then he turns and I was like, oh no, he's coming for me. I did not realize this. And like in a second, like I'm up against the wall. Has his hands on me, like, I don't know, my shoulders, my arms. And in like probably a millisecond, my brain just went through like, okay, like, can I get out of this? Like, no, he's way bigger than me, right? Like, I'm not going anywhere. Okay. Cool. So like, let me look. I looked into his eyes to see, like, can I reason with him? Can we talk? Like, hey, I'm not, a demon that's crawled up from hell or whatever, like auditory visual hallucinations are happening to him right now. Like, and his pupils were just blown. I mean, they were like the size of his entire iris. And I was like, oh my God, this guy is out of his mind. Yeah. And then I had this immediate feeling. I was like, I'm fucked. Like, like he is going to snap me in half. Like, I'm a twig that is going to be snapped. And I remember seeing it from up here and like feeling like absolutely nothing. Like no panic, fear, it like total disassociative experience, which was so like, of course, like I'm nerding out on it now because I'm like, well, that's exactly what happens in everybody's brains when they go through trauma. And like, I'm so lucky because like he did not hurt me. I'm fine. Thank God, I'm totally fine. And this tech that kind of was like, hey man, you can't grab her, you can't touch her, and kind of backed him off of me. When we finally did call PD to get a detention on him, because I'm like, this guy is pretty dangerous. Like, we can't just like let him go. He's gonna hurt somebody or hurt himself. The cop was asking me like, what did he do? And I was like, he did this. And I was like showing, and then the tech was like, that's not how he grabbed you. And I was like, I don't remember. Like, what I remember and what happened. Well, I mean, I remember it the way I remember it.
Right.
But is that exactly what happened? I don't know.
Right.
I don't know. Because it's just what was my brain was doing its job at the time to kind of protect me, right? Like, it was too focused on me, like not feeling pain as my neck gets snapped.
Yeah.
And the rest of the day, I was like this, just like adrenaline, just like, and everyone was like, "Are you okay?" And I'm like, "Yeah, I mean, I feel fine. I feel fine. I feel fine. I feel fine." But the next day, so I went home, went to sleep, came back into the ER the next day, walked down that same hall where he had me up against the wall, and immediately started sobbing out of nowhere. And I was like, and so I went into the...
Sorry, guys. Sorry, Ashley.
What? Crisis?
Oh, we got a question.
Oh!
So this is, we're rocking and rolling. We're getting with the times here. This is how we do it at Breaking the Cycle. We have our staff come in with a handwritten that was probably a comment we'll get to this in just a minute. Let me let you
Okay.
finish your story.
No
but,
worries, no
yeah.
worries. I'm so happy people like care at all to say
Yeah.
anything. So sweet. So anyway, I went in there, cried for like 5 minutes, like short, just total cortisol dump. You know, went back out. I was fine. I was totally fine after that. And like recalling it now, I do feel it a little bit because I am like making it like very explicit in the way I sense all the sensations that were going on.
Yeah.
But it absolutely fascinated me because I was like, oh my God, like this was lucky for me. Like, not that I don't have any other traumas that I can pull up. I'm sure I could, but that specific one, it's kind of safe to talk about in trainings and stuff because it was, one, I'm okay. Two, it wasn't like any attachment trauma. And three, like it was a very clear picture for me of exactly what happens in your brain when you are in a situation that you cannot get out of.
Yeah.
Or your brain perceives that you can't get out of it.
Yeah.
And I was like, wow, that's incredible. I went through all the phases, like shock, and then, okay, can I fight, flee? No, freeze. Okay, now disassociate because you're going to die.
Yeah.
And then the delayed response of okay, listen, I'm sorry. Mwah. I'm beating up this mic today. So, yeah, I just find it incredible that, and also like, I know this sounds kind of crazy, but like grateful because it's like that disassociation piece, like if he would have snapped my neck, like, I don't, like that would be a bad way to go if you feel it.
Yeah.
You know? And I'm like, man, that kind of gives me some type of hope. Like if I die in some type of violent death that my brain is like, girl, bye. Mm-hmm. Like we are not going to experience this, you know?
Yeah, our bodies are really fascinating, but also just really, it's beautiful the way that it works to protect us. Yeah. Our brain, our body, and the way it responds is really important, you know, with these emotional experiences, but also then as it dips into physical experiences where somebody might, you know, have an out-of-body experience.
It was crazy. And the ER staff joked with me for like a year. They're like, girl, you got the survival skills of a fainting goat. I was like, well, that's what you want me to do. Yeah. I was like, you kill me, I'm dead already. You don't have to kill me anymore because I'm already dead. Like, you know, like, so I'm like, hey, it worked. Am I here? I'm here. So not bad survival skills.
Well, and it's a good breakdown too, because there's such a, like you were saying before, a somatic experience when we're talking about PTSD, which, as you had explained in the mist, is our felt emotional experiences in the body and how we store those, but also kind of work through them. But it's just really important because I think to highlight, because the general conversation around post-traumatic stress disorder that you'd see on the media or any of the social medias is a flyby conversation where you're not going to get the time to sit down and have those conversations of deeper understandings, which is why there's such a stigma and people are like, oh, whatever, just don't feel that way. And it's like, well, you know, when your body takes over, whether it's a near-death experience, a high adrenaline, and this is one for dudes too. It's like dudes think that they don't experience those aspects because they're tough, and it's like you'd be the toughest dude in the world. Some of the toughest men report these things more than anyone else. Yeah,
absolutely. And they typically struggle with it internally. Yeah, and self-shame. Like be a man. Was like be a man? Are those on TikTok too? It's like carry this 400-pound couch by yourself. Break your back. Be a man. Like just ridiculous expectations on men to like not acknowledge very human, like regardless of gender or sex. Like your brain and body, our autonomic nervous systems are the same. Like relatively speaking. Yeah. Across genders, like you're going to have a response. You don't have a choice.
Yeah, it's just the way we're wired as human beings. Now it's like you can have all the conversations you want about like, okay, men's bodies are physically denser, therefore we can withstand heat and cold a little bit. Like these are all biological truths, but what comes hand in hand with that is the way we experience emotions as human beings is a thread that unites all of us. We just have slightly different functions as that then manifests physically.
Right. Absolutely. Absolutely. And I think, our expectations culturally too of men and women, and I think we talk a lot about how and I talk a lot about like how women suffer in the world, like we suffer, we live in a patriarchy, whatever, it is what it is. But I think that I'm hearing more, and I like that I'm hearing more about how that dynamic is also so bad for men and creates this existential loneliness for them that is so tragic. Because, like, yes, I think women, and I'll just tell my husband this all the time, it's like, if we get in a fight, me and him, and I need to process because I can't process with him because I'm pissed at him or he's pissed at me or whatever, I have 3 girlfriends that I can call that are going to like support me in my emotions, ground me in reality gently. Like, I know you're really mad, but like he loves you, and I'm not, like really wise friends in my life that like know what it is to be with a partner for, I'm 41. I met him when I was 19. It's a long time to be with somebody. You're going to fight.
Yeah.
But the totality of your relationship, like they've seen us through a lot. And so it's like, I have that space to go, and then I can come back feeling kind of healed and cared for and re-engage with him. Men don't do that.
Yeah, it's certainly a selective percentage.
Not many men.
Yeah. I mean, it's well, there's a lot of things in what you share. Number one, statistics show that women they fare better after many, many years together. We're talking like old couples. When the male passes away, women fare much better than the male counterpart when the female passes away, because a lot of men had done nothing to cultivate not just friendships but community. I've mentioned this one before, but it always reminds me, there's this old viral video that would go around. It was this grayscale video of a cowboy sitting on his porch. And like in the video, it was just so surreal, right? He's just kind of this like stinky old dude who works on a farm, and the flies are landing on his face when they interview, and they say like, what's been like the worst experience in your life? And he just like deadpan looks at the camera and he says, the haunting loneliness. And you just see it in his face. He lives on this farm by himself. And men do this to themselves, absolutely, in the modern age, 100%. And I would say probably forever, because I don't have access to forever to go back in time and see that probably men have lived this way forever, where they just kind of, it's all on me, I've got to do this, and push people away.
Or even like, do they even know how to engage or find those people? It's like, because even if you are a man like that wants that community, I imagine it's infinitely more difficult to find another man that is going to give you the support or community that you're looking for, right? Because like some friends you can go to and they're like, well, that sucks, man, anyways, you know what I mean? Like, and it's like it implicitly or explicitly shutting down any type of emotional expression from the other dude to you, because you're like, I don't know, because the other dude doesn't know what to do with it.
Yeah, and it's real important too, because women are good at this, of like the cultivation of friendships. All right, and you let us know if you need more water. We can always get you some. That's not a problem. Yeah. Hey, Kendra, can we take a minute here, and we'll come back to this point in just a second. You're going to see our producer walk in the front here. Say what's up,
I'm really
Kendra.
Thirsty. It's hot.
Give him a smile. It's all good.
Yes, it's 110 degrees in Texas.
Yeah, it's hot today.
So I'm freaking thirsty.
Yeah. I got here super early in the morning, so I don't know how hot it is out there now, but I bet it's bad.
It's humid too.
If it's getting hot in here where we have to turn on the fan,
it's gross.
That's a problem. Because we keep it cold in this office.
Yes.
I like it cold.
Women's winter, as they call it. The office, the summers in the office. I need 12 sweaters.
Yeah.
Like, it's women's winter again in the office.
Yeah.
I'm always cold. Okay, thank you so much.
Thank you, Kendra. I appreciate you.
Thank you, Kendra. Mm-hmm.
This point of isolation, though, especially for men and friendships and community, I was having this conversation the other day of like how important it is and was for me with some of my, like, let's say high school friends who aren't exactly like the epitome of mental health. They're good dudes, but I made it a point early on with a lot of them to like, hey, there are certain things that we don't say to each other, right? There are certain things in the way that we say them that we need to be able to be vulnerable, right? And they were those kind of dudes, right? I was that kind of dude. They were that kind of dude. It's worked out. It's why we've been friends for 20 years. You know, it's like we don't say things when we're mad at each other like, hey, we're not friends anymore. We don't do when we were younger. That was one where it's like, hey, we don't say shit like that to each other, right? You know, but dudes aren't always the best. It's like, oh, bro, let me hit you in your balls and then tell you you're an asshole and we're not fucking friends. And then the next day we're hanging out. It's like we don't do that stuff to each other, you know? And if we are, like, as we got older, it's like when we do catch up, I want to know about your family. I want to know about your kids. I want to know about your job. I don't want to just talk about sports. I played sports for 19 years and I don't want to sit around and talk about it. I don't care. I just don't care.
Yeah. You know, it's I want to get on the level with you and get to know you as a human. Yeah. And I should clarify that Kirk does have a couple really good friends that he does talk to, but I think that it's just harder. I think for guys, it is. It has to be more. I think and maybe it's also like it has to be way more intentional.
Mm-hmm. Well, it's here's a point too. Is like one of the reasons that it's harder to cultivate community for men is the simplicity behind it. I was talking with another client the other day who has really done well in building a community. And we had spoken 2 years ago. And I said, all you need to do is go somewhere that you're interested in, a social activity, and show up consistently at the same time every week and be sociable. And you will make friends.
Yeah.
We're 2 years down the road. It was that simple. He's a sociable guy, right? He has a group of friends that'll come watch his dog. He watches their dogs. They do stuff together. Yeah. It helps too. I think there's some 12-step recovery in there on the family and friend side of things. So he grew up in an alcoholic home. That's something I know personally as well. As like my community really built when I decided to build my life around understandings of why I wasn't. And that's kind of that piece. Like men don't get raised or reared or geared towards looking at the reasons why they may struggle to go consistently to a space and be sociable, you know?
Yeah. I think that's absolutely true. And, you know, and I come from a very sensitive father. And like the men in my family are super, like my mom is less emotional than my dad and my brother. Like they are really great examples to me of like really strong men who also are like very much in touch with their emotional self, you know? And so it's interesting to me because like that's what I see as a norm, right? But then like if I step out of my family, like that's not really a norm at all. But I always thought like, what? So, you know, like we talk about feelings all day. You know, my dad's a now retired chaplain, and now
that'll help.
Yeah, and the best grief counselor ever. He just got, you know, it's really cute. So he retired from chaplaincy, and he's like, he did a coaching certificate thing. He's like, I am not getting any referrals, and I'm like, yeah, I don't know if that's like. I mean, you have a lot of experience, like. You have your 2 master's degrees, a doctorate in ministry, like you're a chaplain, like what are you doing? Like just get your LPCA or something. Yeah. And he's like, it's been like since the 90s. It's been like 30 years. You couldn't even get all his records from like West Virginia or wherever we lived at the time where he got his master's in counseling. So he had to do some leveling courses. So now he's an LPCA.
Oh, nice.
And like he's 70. Like, so I'm like, you're so awesome. I'm so proud of you for cool. Doing this at like. You know, you don't have to. Yeah,
maybe
but
it's
he loves
a good way to help.
Yeah, he's a helper.
Yeah. He's
a helper. He's definitely a helper, and super proud of him. Yeah, he does. Grief is his jam. And I mean, I can do grief work.
Sure.
But I like it to be complicated and get into trauma.
Yeah.
Not just regular sadness. Blah.
Yeah. God bless.
Yeah.
Let's take a pivot here because we had, I believe, a comment that came through on the live. But I want to make sure I read this, relay it to you, get some information. So people are looking for any recommendations on coping skills for how to help an adolescent with dissociation, possibly associated with PTSD or trauma. This is right in line with what we're talking about. But how would you, Ashley, work with adolescents who may be experiencing this for the first time?
Well, one big thing is like normalizing, right? So I think there's multiple steps to helping with disassociation. So I don't think there's like a one size fits all for sure, but I think one is like the psychoeducation and normalizing. So basically that just means like letting people know like when you're in an overwhelmed state, you may disassociate. Disassociation is a completely normal thing that we all do on a spectrum. It's a survival skill, and it's also just something that our brains do like when we're not even noticing. Daydreaming is a type of disassociation. If you've ever driven home in traffic, right, and you are like, I'm already at my exit, or you miss your exit because you're like thinking about whatever, you're disassociated at that time, right?
Yeah. Here's a common modern age one is like, if you're ever sitting watching TV and scrolling your phone at the same time, and then you look up and realize that whatever was on the TV is now over and it was a 30-minute thing, that's a form of dissociation as well.
Every night. I put on Downton Abbey and scroll my phone. I don't know what that means about me, but I've already watched it. I feel like it's your
comfort show.
Yeah, they're all like so polite. Like even when they're like brutalizing each other, like, but like this, like, anyways. And sipping tea, and I don't know, it's very vanilla. It's very, I don't know.
It's a vibe.
It's a vibe. It's just a chill vibe, Downton Abbey. So normalizing it, like it makes sense that that's happening, right? Like it's not anything bad. Like I think anytime you push against a part of yourself that is coming forward aggressively, like disassociation, and if you try to fight with it and make it go away because I want you to go away, whatever this part of me is, it's gonna fight back. So I think normalizing, giving it a ton of compassion to why it's present, like so speaking to the disassociation maybe a little bit, like putting your hand on your heart and saying like, I see why you're here. I recognize you. I see why you're here. Thank you for trying to help me. Thank you for trying to help me. You're trying to protect me right now. That's really important.
If we could pause on that one for a moment, because I think a lot of people, they'll hear it, and this is prime for like ripping stuff apart of like, oh, of course, therapist, right? Thinking this thing. It's like this stuff practically works.
It literally works.
It's tangible. It works. I had a young male, he's in his 30s. He had a recent surgery where they had to do an injection into his eye for some vision issues, where now he's got, until it dissolves, the medication in his eye is this little square, like rectangle piece in the field of his vision. And he was real pissed about it. And in the session, I said, well, instead of being against this foreign object, why don't we take the position of thanking the medication in your eye for being there trying? It may not work. Maybe it works, maybe it doesn't. But what about just thanking it for trying? And like being there to like that it's even an option, Yeah. He came back the next week and it was, just a different shift, not just in his mood, but just like how the gratitude,
Yeah, the gratitude for all of us, right? Like all parts of us that come forward when there is something traumatic that happens or you're having distress. And then the other thing is like when a really like very practical, if you just want like a straight up practical tool is there's something called autogenic training, which I think if you Google it, it basically is it's like a progressive muscle relaxation, but it's like you're attuning to different parts of the body and just giving it a message. My forehead is warm and relaxed, or cool. My forehead is cool and relaxed. My forehead is cool and relaxed. Like any practical strategy to get into connecting with the body in a safe way. Now, some people who have even more significant disassociation, sometimes they need, if they're feeling really, really out of their body, it could help to like hold a cold ice cube until it melts. Ground. I always say that yoga, any kind of yoga, but like slow yoga, like if you're struggling with any kind of PTSD symptoms, whether it's disassociation or hypervigilance, right? Because it usually flip-flops between the two. Like once you come out of dissociation, you're going to have some big feelings.
Yeah.
Because you've been so disconnected and this is going to maybe flood you. So I think yoga, really slow, gentle yoga is one of the best tools. Because you can do it for free on YouTube, like at home, if it's a safe place to do it. My best work with disassociation is IFS work, and that's
internal family systems.
Yeah, that stuff works, man.
Yeah, it does. Yeah, it leads into some real good experiential work. So, like, you know, for those who may not know what we're talking about, it's just like real practical confrontations that are compassionate. And help you kind of work through the felt sense of your emotions in your body, whether it's actively getting you out, confronting things in your life, or in the safety of a therapy office, working through ways that you would talk to people, ways that you would talk to different parts of yourself, these kind of things. It's much more complicated than that. I'm kind of trying to water it down a little bit and see if there's more you can add.
It's IFS is such a weird, first of all, I think it's a weird name.
It is.
Like, because I was like, internal family systems, I'm like, is that like family work? Like, I don't.
Right.
Like,
I've always liked, there's this one book on IFS called Self Therapy.
I was just about to say that.
Yeah.
Is it Deborah Weiss?
Something like that.
Something.
Yeah.
She has a
it's really
workbook
good
too. Yeah, it's really good. And I use it all the time as like a way to introduce like the concepts. Like either you can read it or like we'll read it together in session. Just be like, this is what I'm talking about. Yeah. But I think for adolescents and kids, I know we talked about it last time, but I swear I use this as an example constantly, is the Inside Out movies.
Yeah.
Like using that as like the best way to think about sometimes your emotions are your inroads to finding those different parts of self. Like when I'm anxious, what part of me is anxious? Is it my right now self that is talking to you, Alan, in this chair? Or is it a part of me that is very young, that got bullied, or that feels like they're socially awkward, right? Like, why is the anxiety there? Like exploring when I think about times in my life where I felt anxious, like what age was I? What was happening at the time? And then using that as a strategy to, which kind of going off into like a therapeutic space, but like then you start to get to know that part of you, like that holds the anxiety, or the part of you that holds wisdom, or the part of you that holds a role in your life, like mother, or, you know, there's so many different ways you can come at it. But I find people who experience quite a bit of disassociation, if they're struggling therapeutically or they're struggling in their lives to get into their body, that I will oftentimes use kind of a part. Is there a part of you that can be 1% here?
Yeah.
Okay, what does that part look like? What do they sound like? You could look like a green caterpillar. I don't know, whatever. However it comes up for that person. And so helping, I think, disassociation, when you're working with disassociation and clients and you allow them to have space for it, then by working with those different parts of self, rather than saying disassociation, you're in trouble, you're not allowed to be here. You know, I think that's super critical to help somebody slowly but surely get back into their body, because it is not something that's going to happen like in my story.
Yeah.
Where I was just like, oh, now I feel better because I sobbed, and now I feel, and like I processed it in 24 hours because I'm a therapist, and it wasn't that, I mean, I didn't think, it's not that big of a deal, right? Like really, I'm fine. It could have been a big deal. But for people who have things where they didn't get away, where they were hurt, that your body is trapped in this space of like, it's happening still.
Yeah.
So I have to continue to dissociate.
Yeah. And there's often such a, this is when I learned young in the field, is there's a displacement, right? Because it's consistently happening, is I need you to hold this, I need you to hold this, right? And it's not even just the parts, it's the actual event that they're trying to give away. I remember one time I was working with a young drug addict when I was early in the field, and he was telling me about a story, and I didn't know at the time how to hold my personal boundaries. It was my first year of like internship practice. And he was in a brutal spot, and he was telling me about witnessing someone get their head blown off with a shotgun. And it was such graphic detail that when I left the session, I was sweating, right? Like hot coals in the stomach. And I remember going to the psychiatrist that worked there at the facility, and like, why do I feel this like deep pit, like hot coals? You know, like when I went home after that day, I couldn't sleep. It was just burning in my stomach, and like, it didn't happen to me. And he was talking about, you know, the transfer of like carried shame around traumatic events too, of like, he handed you the hot coal and you said, okay, I'll take it.
I'll take it.
Yeah.
I need to feel this with you.
Right. And that, you know, later on, it's like when I'm doing my own trauma work in life, there's that young part of me, probably some of my like teenage self, that was always such a helper, a fixer, a saver. You know, I'm watching people that I love in my younger years die slowly to a disease that they're not even aware of, but is clear as day to anybody who's looking, and I can't do anything about it. I became such a little helper, fixer, and a saver. I'll take it for you. And I always joke, like with my sponsor, he says, what an idiotic thing, as if someone 2,000 years ago didn't die for that. You know, It's like that's our like religious discussions, if you will, or spiritual understandings. But it's like, yeah, it's not on me. It's not on my ledger to take someone else's pain. I don't have to take the hot coals. What we have to do is what you're describing, is help them understand what place in their life those hot coals are burning.
Right.
You know, where is that coming from? How old were you when the fire was started?
Right.
You know, and can we help you extinguish it there? You know?
Yeah, that part of you that is stuck in that spot needs something.
Yeah.
Something needs your adult self to know something, needs to be seen in some way, heard in some way, comforted, nurtured in some way. And a lot of attachment trauma, which is a lot of what I work with as well, because I think that I think it's more prevalent than people
Sure.
really think about, because also it's like, well, whatever dysfunction is in my family, it's like normal. And like, you know, I can't tell you how many patients I've had that have said, or clients that have said like, well, it's not like what other people go through. It's like, okay, do you have to be like on the Gaza Strip getting bombed to have a right to some suffering?
Yeah.
It's like, you also suffer.
Yeah.
It doesn't look like maybe what you see on the news or what's XYZ person experienced, but it's still occurring, and like, it's okay to give yourself the permission to like say that it's painful.
Yeah, it's not a comparison.
Right.
And thank God that isn't what you're going through. However, if you deny it and downplay it, what work could ever even be done?
Right.
I realized this too when I was doing my dissertation, right, around the substance use world, is like the percentages are such when surveys come out each year, like on the National Institute on Drug Abuse, it's like the percentages are such that you and I will never in America walk down the street and not cross paths with somebody who is either in active addiction or in recovery for active addiction. Those are the sheer percentages, you know, of the millions of people just in the areas that you're living in a populated city that are struggling actively with substance use. Those have massive impacts on family dynamics that are often under-discussed, not looked at, and cause major conflict. That's before you talk about anything else.
Right.
All right. This is just one slice of the pie. It's a massive one in our culture, right? We have a hugely codependent culture around substances. It's on every billboard as an advertisement for some kind of change of state in your mind, and it affects the family system. But it's like you're never going to meet someone in a family who doesn't know somebody
Right.
who has impacted the family dynamic with their disease. That's before you talk about the way people treat each other, the way people talk to each other, the things that you regret. Like when you're a good person and you say something you regret that impacts the family system. I mean, it's an entangled web that would take us days to unravel and still have millions of things more to talk about. But to then downplay and try to compare it to like, well, I wasn't a soldier. I didn't do this, right? It's like everybody's family has issues.
Yeah.
Some are worse than others. But if we get caught up in the comparison, no one's ever going to be able to talk.
Well, and I think like what you're saying earlier about that thread that kind of like is pulled through like the human experience, which is super important. And a lot of where I start when I work with people with trauma is mindful self-compassion practice, which there's like 3 components, right? The first is noticing the pain, like, ow, this hurts. Like, this hurts, or this sucks, or whatever you want to say. Like, this is a really hard time for me right now. So like just acknowledging the pain is the first part. The second part is the acknowledgement of common humanity in pain. Like, we all suffer, some more, some less, some different than you, some exactly very similar to you. But one thing that we all know as humans is suffering is part of life, and in a sense that like you're going to have pain, I'm going to have pain. Suffering is real across the human experience. And then the third part is that loving compassion from you to you in the suffering, in the pain. Like, ow, this hurts. I'm part of being human. I'm not alone. Okay, I love you, Ashley. I love you. It's okay. Yeah. And also, the physical touch is so critical because of that oxytocin from you to you. It's like when you hug another person, you get that oxytocin, that love hormone that happens when you have a baby or when you're in love with anyone, really. Like, it's a bonding chemical, right? It's not specific to a parent-child relationship or even a romantic relationship. It's just a bonding chemical that occurs in our brain. And it releases when we have human contact with each other. And it also releases when you hold yourself as well. Probably not to the degree as if you're getting a big hug from, like, you know, your grandma. But
effective enough in the moment, too. It's like when you're reprocessing things and when you're reliving things, you may be able to produce enough to have an effect, which is a lot of what we're trying to do with medications. You know, these things are all connected. We do it in a different way with medications with different chemical strands, right? But the oxytocin, right, that we can provide ourselves is really, a lot of times you don't need much.
Right, to give yourself some nurturing, which is I think it's super difficult. I mean, it was really difficult for me to do it when I started doing that kind of work and practice with myself, because I think there is something like, you know, I was also kind of raised like helping is like the closest to being like Jesus, basically, right? Like, it's like, which is not untrue, right? But it can get, if you're a sensitive child, which I was, like almost like martyring your own needs in some way for others. Because if you do that, that makes you a better person. And then if I give that same compassion and love that I give to my family or my friends or my clients or whatever to myself, that's like bad, like selfish in some way.
And it is. It requires the proper definitions too, right? As I know the direction that you would go with it, and then we would agree on this is like, first, it's like with the breakdown in the definition between helping and service, and then the breakdown of the definition between selfishness and self-centeredness, right? It's like helping always has a cost, right? Because oftentimes, especially in our society, you weren't asked, right? But if someone asks you, that's service, right? It's like you'll see that kind of stuff all the time where it's like kids are a really good example of this. Like, they're going to help with something else going on for the other kid, but then they spill their snack. It's like helping has a cost. You know, they didn't ask you, and so therefore it wasn't this deliberate, intentional thing.
Yeah, it's like I don't remember I did not come up with this. I saw it on TV or something, but it was like unsolicited advice is always interpreted as a criticism.
Mm-hmm.
Unsolicited advice is always interpreted as a criticism.
Yeah.
Mom. No, I'm just kidding.
Yeah, mom.
Mom.
Yeah.
Yeah, but yeah, I mean, but the goal, right, of the person giving it is like they feel some pull. There's something in them that is anxious about seeing whatever.
Mm-hmm.
Now I'm gonna go help.
Yeah.
Rather than like dealing with my own feelings about it, and like also trusting the autonomy of another human being, like, and that's the thing, to have the capacity inside themselves to help themselves and to know when they need to ask you.
Right.
And I think that that's like the biggest thing that I've learned over doing therapy with people who have gone through things that I cannot even imagine, and see them recover.
Mm-hmm. That they have not just the wherewithal, the capabilities, but the power to do that for themselves.
They do. They just don't. It's our job to help them find it.
Mm-hmm.
But it's in there. It's already in there.
Yeah.
And that's, and I'll tell my patients, I'm like, isn't it incredible that this has been in you the whole time? Like, we just had to be able to see it.
Yeah.
You had to give yourself permission to see it, or whatever it is that's blocking your own post-traumatic wisdom and power that exists within you. But trusting, I think there's nothing more respectful, and not just as a therapist, but as like a parent, right? Like, I trust you, child,
Right.
that you're gonna be all right. You're smart enough. Like, I'm here for you, whatever you need. And also, I don't need to manage everything, because I'm gonna trust that you're gonna be an adult that can handle life.
Yeah. Well, and this one is observable in society. When the parent steps in to help, you have then directly stolen self-esteem from that child for yourself. You're not doing that for the kid. We know we're doing that for ourselves. Mm-hmm. Some people don't know, right? Quote unquote. It's not conscious that they're actually taking the opportunity away from the kid. But this is what society has told us to do. Like you said, I have to martyr myself. It's like, stop helping. Unless you're directly asked, and you have then the autonomy to observe and see in the weight in your life of like, do I have the room to be of service here?
Yeah.
That's the biggest, I think, like, cornerstone. It's like, I can be asked to help. I then need to discern for myself if it's good or what could be better for me in that request. And if I just decide to help and I haven't been asked, you're absolutely right that it comes across as criticism. It reminds me of the age-old book, Don Quixote, where he travels the countryside and tries to fix up other people's farms, right? And everybody hates him when he leaves their farms, and only to go back to his own and it's in shambles.
Right.
It's like, yeah, well, the guy was losing his mind while he was doing this too. It's like, this is a tale as old as time.
Right.
Yeah.
Right. And and I also want to like put this in a space of like also not like yes, we can have that awareness, like even me as a therapist, like that awareness of not helping, right? And I want to make it like clear that like superhuman, I am also a human, and like, my daughter is on the autism spectrum, and she's, she does need more support than other people, but I think that my own anxiety, right, about like how is this going to play out in her life will totally like overtake my brain and body, and like stuff like, opening a freaking candy bar for her or something that's like, I'll just do it automatically, and I have to so intentionally and conscientiously catch myself and be like, she can do it.
Yeah.
She is capable. She can cut these carrots or whatever the thing is that she, she's been into baking a lot lately. And it's like, disastrous afterwards because, you know, it's like just a mess. But it's like, let her. And if it's not perfect, like, who cares? Like,
Yeah.
she's learning that when she wants to do something, she can do it. And I think that's like the so I may have the awareness, like, intellectually, that like what I'm supposed to be doing, but there is like a humanness of being a parent that is like instinctual rescue behavior.
Yes.
And it's lizard brain stuff, because it's like, you know, yeah, if we were in the cave, like, maybe I would have to, I don't know, open a candy bar. I know, see, it's not rational. Like, I'm like, maybe I would have to open all our candy bars.
Well, you know, it's like if you're in the cave, maybe you would have to kill the animal.
Yeah, I would have to kill the animal, but they would still, like, okay, but then if I get killed by an animal, like, they still need to know how to make a fire or whatever, like, you know, like.
Well, in that the eternal truth is like they would then, by necessity, go bite the head off of a squirrel. They would do it.
Yeah.
They would figure it out. Especially kids, they are feral. They'll figure it out.
Yeah, for sure.
You know, it's like, I remember learning those kind of things, not to say that I was good at it then when I got into my adulthood of like getting my hands out of the cookie jar. But like I'd overhear like my older brother, I was bigger than my siblings, right? I inherited the big, tall, massive person genes. And I'd hear like my brother, like, I really want to move my desk. And he'd be talking to my mom about it. And I'd be like, well, yeah, I could move that thing. And I'd go and I'd move it for him. And then it'd be like, Alan was in my room. You know, it's like, yeah, he didn't ask me to move it. He might have, you know, but it's like, and then I, you know, it's like, it's all the stuff that happens in family dynamics. Then I make up in my mind, like, well, what an asshole. What, you know, you know, you were just talking about, I thought I was being nice. That's not an act of service. That's me doing for him what he could do for himself.
Right.
You know, and who knows? People probably will ask you for help if you take your hands off.
I think that's true. I mean, I think that there's like a presence, like being and I guess like it kind of makes me think back to like saying like, I don't like doing grief work. You know, it's not intervention-y enough. But I think that's something that I did learn from my dad, and is that there is nothing to be done for this person in a space of tragedy or what. Like, if you're sitting with someone in the hospital whose kid just died, or whose, you know, spouse just died of suicide or something, like, there's nothing that you're going to say or do that is going to make it better for them. In fact, if you open your mouth and start saying dumb crap, you're going to, like, make it worse.
You're going to piss them off.
And make them feel like shit. Yeah. And, like, feel so alone in it. And so it's, like, this idea of, like, a persistent, patient presence in suffering with someone else without trying to fix it, and just saying, like, you have permission to be in this space, and I'm going to be right here with you. Yeah. That's, like, enough.
More than, yeah. People respect it, too. It's necessary. It shows that you understand. You know, a couple of years back, I get this call from my client, and, you know, in private practice, you don't get many crisis calls.
Right.
And so when they were calling, I was like, well, you know, I'll pick it up and see. And her son has peanut allergy and had accidentally been exposed at school and was in a coma.
Oh my God.
And she's losing it. You know, I'm, you know, walking her through, just kind of like inviting her to share for a moment. She starts sharing. I can hear the nurses in the background. She's hysterical for a little bit. You know, she's getting it out. And really all I did was sit on the phone and listen. I asked a few questions in the beginning, and then I shut up. And when she came in over the next few weeks, she kept mentioning how, like, the nurses were like, God, what a great therapist. So, like, I didn't even say anything.
Right.
And it's not about being a great therapist, these kind of things. It's just about, like, when people are struggling, it's like, can you be there? Can you be present? And that's where a lot of, like, the relationship stuff, when people come in and they're, I want to work on my relationship, we're not connecting, they're just not there. You know?
Right. Or they're trying to correct something without being present. Like, it's like, I'm going to go into fix it mode or whatever.
Right.
And then that shuts down people, because I think there's an implicit or like unconscious part of us that feels not trusted or not enough or bad in some way. And in our suffering, when we're suffering and someone comes in and tries to correct it or fix it for us without the ask, then it feels like, I'm not allowed to have this feeling is bad. I'm not allowed to have it. I shouldn't even feel this way. And then and yeah, they might stop crying, right? But did you help them?
No.
You know, it's like that old thing, like when we're in therapy school, whatever therapy school you went to, whatever degree, and it's like the question of handing the tissue. You know,
Yeah.
like, are we allowed to hand a tissue? I don't. I just, but that's like you just have the box there and they can take one if they want, but it's like, don't ever. I just remember, like, don't ever hand them a tissue while they're crying. Like, and people are like, but that feels so insensitive.
Yeah. And one of the perspectives, this was somebody who had a lot of years in the field, is they said, never underestimate the need for a person to feel the tears run down their face.
Yeah.
That was one of the reasons when I was in person, there would be largely like long periods of time where I just wouldn't have tissues in my office. Use your shirt. I'm not going to judge you.
Yeah.
Let it roll.
Be in it, be messy. I do love, and that sounds, I'm having this memory of while I was watching Downton Abbey the other night, and I put my TikTok down to actually watch it. It was like this really like touching scene, and like both my eyes, I was like just like letting tears roll, and it felt so good.
It does.
And I was like, oh, that was cathartic.
Yeah,
I don't know what I was crying about. I don't know if it was about, Mr. Barnes or whatever his name is. Yeah. I pay attention like halfway, as you can see, but
yeah. But it reminds me, it's like when I had done some experiential trauma work, I went to the Meadows. I did their Survivors Week. And there is some of the experiential work that got so deep into things that were causing issues for me interpersonally, and this, that, and the third, around the family disease of addiction and just people not in my life doing their work, and feeling alone in it. And there was this moment I was doing some of the work and I had these tears and they were hot, like hot. And it was one of my first introductions to like real trauma work. Like, how did my body at a normal temperature just produce hot, like to the touch tears? The sensation of it really was ultimately what was actually happening. It's like you could probably take a sample of the tear and the temperature is not higher, but the sensation.
It felt.
And they asked, like, do you want, and I remember the only thing I could think was like, I want to feel this, And I was also remembering that point of like, never underestimate just how powerful it is to feel the tears.
You have to feel through it. And I think that's why I love EMDR and I love trauma work, is like talking about it does not allow for an experience.
Right.
At all. It allows for storytelling, which is important, but it also, the thing about processing only verbally is that it really focuses on intellectualizing whatever happened. The who, what, where, when, why. Like, we don't need, like, we know all that. You already know it. But then it's like you have to experience the emotional sensations of what your body has been avoiding, either through substance use or maybe depersonalization or derealization, any kind of disassociation, or maybe hypervigilance, anger, and like projecting it into some other thing that's happening in life that has nothing to do with like this thing that has not been processed in your body. And it's like, I always tell my patients, I'm like, look, trauma is like, this is like a big river of shit. Okay. And there is no way to get through it except to walk through the river and experience what that feels like. And then you will get on the other side and look back and have a different sense of what it was like in that river. But if you don't walk through it, then you're just going to be stuck there.
Yeah, and life will pass you by.
You're going to be stuck.
Well, and even as I hear you, this is why action is so important, right? It's like you can have all the insight in the world. Oh, I'm in a river of shit and it smells like shit and I'm covered in shit. But then you're just covered in shit.
Right.
And the flow keeps coming.
You just sit there and think about it for a while instead of like walking and moving through it, right?
Yeah.
Like, and just, you got to.
Yeah. walking through it gets to the roots, going through with action. It will allow you to let go of coping mechanisms that were unhealthy, that, like you were touching on, some of those ways in which people will turn to certain behaviors that are coping, but they're just not functional, right? You will then pick up others that are also not functional, and then eventually we can pick up some that work, and in your own time you'll be ready to let go of some that are maybe less harmful but you held on to for a long time. This is how trauma work works. But if you don't take any action toward finding the new healthier ways, then you're stuck in the same patterns of what action already has been that leads to inaction.
Right. It's an avoidance, right? Like your brain does not care if you thrive. It cares if you're alive. That's it. Like the most basic function of your limbic system is to make sure you live. It is a very powerful part of the brain. It does not care if you have a healthy marriage. It does not care if you have friends in your life. It cares that you are breathing and eating, basically, that your heart's beating, and that you're breathing, and then it's like, okay, cool.
Yeah.
But if there's something that the limbic system is reading, aka like whatever happens in life that pulls back up that trauma pain, your limbic system is going to shut it down however it needs to. It's going to be like, nope, because that pain, the limbic system can't read like the prefrontal cortex, like, oh, that pain is not the same as dying. You're actually going to be fine if you have a difficult conversation with your coworker, right? You're not going to die, but your limbic system doesn't have the capacity to process that. It is just going to read it as a perceived threat of pain, emotional or physical, and then that will read as, I'm going to die, and therefore I will avoid it at all costs, and your brain will just be a little asshole to you.
Yeah.
So you're right. Yeah. But I mean, I think if we can I think the thing is just recognizing what its function is for us, appreciating it when it's useful, and then also like working on saying like, okay, like I see what you're trying to do for me, but right now I also have this. Yeah. Like I have this right now too that I can use brain. And so it's like learning the what is, and also I have this. Like that's what trauma therapy for me is, like helping people find what that is. I also have this, I also have this, I also have this, and letting the brain really integrate that, getting the feedback from the brain to the body to the brain to the body to the brain, to keep reinforcing those neuronal pathways to say like, hey, yeah, like, whoa, we can actually do this, we're safe. I'm not going to die. I might sometimes feel that. And how do I know I'm feeling that? And then you start getting to like, what thoughts, emotions, behaviors cue me into thinking I might be in survival mode.
Yeah.
Like, so it's recognizing it.
Yeah. And it's our responsibility to do so. Would be kind of that next kind of higher function stage that, your brain isn't it's not gonna function, like you said, past this point of like, let's keep you alive, right? It's like we have the capacities to think about all the things and to reason with things, but once we move into that space of these new tools and this new way of living, as it pertains now to our connections with other people, we have a very real responsibility to take care of ourselves in those ways. It's what clues us in when I think are in that space where the unhealthy survival tactics are taking place. It cues us in that something's wrong, is because we're not taking the responsibility of how it's interacting with other people, obviously.
Yeah.
And that's a progression. I'll talk with a lot of men about this. Young men typically who are failure to launch kind of situations. It's like, first it's consistency. You got to start to try something new. Then it's a commitment to this new thing that's been recommended to you that you're starting to see works. Once it starts to work, now it's a responsibility, all right? And once it's your responsibility, now it needs to be a priority, all right?
Yeah.
If you can do those things, life will be very kind to you when it can be. If you don't, life's already going to be shitty to you. It'll just take the opportunity to be even more shitty,
right,
because you won't be paying attention.
Right. Like, I don't want to like whether you put your head in the sand or not, like life is gonna happen.
Yeah.
And yeah, life is
Yeah.
It's hard.
Yeah, it's like I'd rather pull my head out of the sand and see the swift kick coming trying to hit me in the ass, than just bury my head and be like, that hurt.
That hurt. Oh, why does this always happen to me?
Yeah.
And like instead of being like, well, maybe it's because you're standing in a spot where you're gonna get kicked all the time. Like,
right.
And like it might be hard to move. I'm not ever saying like change is so hard.
Yeah.
So hard.
Transitions are difficult.
And so worth it, You
know what also, it doesn't suck about the work. It's just, it's a truth. It's like, if you now decide to pull your head out of the sand, you can never put it back in because now you've seen the leg that's kicking you in the ass. You don't have to guess as to what the pain is anymore. Now you're letting yourself get kicked in the ass.
Yeah, yeah. And then I think that knowledge in and of itself is like transformative for a lot of people. I mean, you work in addiction, me not so much. Because I don't know. It's not my passion as much as trauma work, although they go so hand in hand.
Yeah, it's the underpinning to any addiction. Period. End of story.
I think it's just I would rather work with a person once they've got their sobriety under their belt, because not to say they have to be perfect, because they really don't. But for me, it's hard. It's just hard to do the work when their brains aren't in a space of like really being able to like retain it, process it, because like if you do, EMDR work, and after every session, someone's drinking a liter of vodka, like it's not getting reprocessed. You're like it's unethical at that point. Like I'm not helping you.
Right.
Because like your brain isn't retaining any of this. Like we got to do like step one.
Yeah. And that's even with small amounts, right, of substance use. I'm not even going to talk to you. It's like a client comes in and they're using even small amounts coming into a session. It's unethical for me to sit with you inebriated, right? Or to then put it in the context of when you want to do depth trauma work, right, that requires action consistently outside of the therapeutic sessions. You're not going to do any of that if you're actively using substances, even if it's recreational for you, because it's a distraction from the deeper feelings that would come up during those times. Mm-hmm. And this is something that's hard, right, when you're talking to the general public. It's like, well, I'll take somebody in who has 90 days clean, knowing in my mind that in order to build narratives around willingness for long-lasting recovery, we're not even hitting those barriers until 3 years. 3 years in, and the lights will turn on. Then from there, I can make specialized recommendations to somebody like Ashley to do some depth trauma work, right? Or to go to some kind of treatment for those things. That's not only is it a really hard sell, but somebody willing to commit to that. And this is where I feel truly blessed in my work, is like I've had a lot of people commit to those roads, and they are different humans today. Yeah. And it's hard. You're going to get chewed up and spit out around every corner as we're trying to build those narratives of a new you that aren't even going to make any sense until your brain is healed. All right. And people aren't going to believe that that's the work we're doing until they see it. And that's why I always tell family members, like, just back off. Just back off. Let the work happen. Yeah.
I think, and, some EMDR therapist is probably going to pop on here and say, like, you could do EMDR with substance use, which is true. But it's a very specific thing that I don't do.
Yeah, it's like you could do it, but should you? And this is a reason why I'll sit down with Ashley and not you.
I think some people will do it in order to not processing the trauma, but I think they use it in protocols with substance use itself. Like the target is the substance use. Mm-hmm. But again,
I've heard of it. Yeah.
I've never done it, and I'm not trained in. I'm not going to get trained because I don't want to. But I like other stuff.
Yeah.
But I mean, it takes people got plenty of issues. There's plenty of people who need different types of therapy modalities. Like
Sure.
like it's okay.
Well,
you can specialize in one thing.
And the people close to me in my life would probably laugh because I can be kind of abrasive about some of this stuff. But it's like we used to try some of those. We'd have people try the EMDR stuff when I worked at the Salvation Army, and then you're trying
It's
that.
not gonna work.
Yeah, they're doing butt stuff in the showers afterwards. It's like it's not working.
Yeah.
What are you doing? You know?
No, that's not gonna work. I mean, I love the idea, like, of course, like with the community work I do with the nonprofits, like I want my therapists to be EMDR trained if they're working with a person who's indigent or not. And also the reality of the amount of safety that your body and your environment has to have for it to be super impactful. At least what I've seen is, Maslow's hierarchy of needs. Like, there needs to be some type of safety for us to work on the trauma, because otherwise, and I think safety in the body also includes, like, is your body, like, safe? Are you safe in your body? Like, are you, like, hurting yourself with substances or whatever? That if that safety isn't there, then we can't get to the next step, because your limbic system can't calm down enough for us to do the work.
Yeah.
I think, and that's my opinion. That's just my opinion. And that's what I've seen.
Yeah. Well, there's plenty of, obviously moving more towards an empirical understanding. There is a push around a lot of these things with emerging trauma interventions of like what is ethical and what isn't working. It's not even that it could cause damage, because most of the time when you're working with let's say addictions, it's like you're not going to cause any more damage they're already doing to themselves, but that's the point, that it doesn't work.
Right. Exactly. Like, I think, and even like in my experience, it's been where I've seen it not work is like particularly in like abusive partner relationships, where one partner is coming in to do the trauma work but is still being abused in some way, and almost is like addicted themselves to this cycle of intermittent reinforcement of love with their partner. Like, oh, I'm good, now I receive love. Oh, now I'm bad, now I don't receive love. Or now I'm good, I don't get hit. Now I'm bad, I get hit. And so that work, and to be fair, like EMDR is an 8-phase model, right? So what I should caveat is say, stage 4 is the reprocessing of the trauma. The first 2 phases we could do, but we're not going to get past phase 2 for a really long time if you're in addiction, if you're in a lack, if you're experiencing a lack of safety consistently. It's going, because resourcing you can do all day long. And I have had clients who I have seen for 4 or 5 years. Yeah. And we stayed in resourcing, self-compassion work, mindfulness, DBT, CBT skills, behavioral activation, somatic work for years before they were in a safe enough place for us to touch the trauma in depth. And that's okay. That is okay. I just won't go there without that. That has to be there. Otherwise, it just doesn't work. And then people are like, and then I think that does do a disservice to the client, because they're like, oh, I've tried this, and nothing works. I'm like, well, it works if you do it the way it's meant to be done, which is like you have to have some sense of safety. Right. You have to be able to touch it in a real way consistently for you to be able to then jump off the diving board into a pool of whatever hell that you experience, like, right? Yeah. You're gonna revert back to disassociation, intellectualization, or whatever coping mechanism that your limbic system prefers.
Yeah, and a big one in therapy too. And I hold this one up for individuals when they come in, like, I want to work on the trauma. Like, oh, you've got the wrong therapist, because I'm going to walk real slow with you.
Steady wins the race.
And then I'll hold things up. Like, remember like 3 months ago when you shared that traumatic incident, and then you didn't talk about it for 3 months, even when prompted, right? That's why. Right. All right. you'll be ready when you're ready.
Yeah.
You know, don't come into these spaces and try to force it.
Well, I think, it's like a desperate, it is desperate. I mean, it is desperate. People feel desperate when they're in that amount of pain. I feel desperate when I feel pain in that sense. Like, I know that desperation as well, of like, I can't keep going on like this. And like, this thing I heard is going to make it better.
Yeah.
And it's like, well, yeah, it's just going to take a little bit longer than you might have hoped, but you will consistently get better if you consistently do it.
Yeah.
Right? Like little steps, like you don't have to be perfect. And I mean, will say this a million times. When I first learned EMDR, I was like, oh, I want to hear all of it right now. And I, to be honest, when I first got trained, I was like, this resourcing stuff is boring. Like, it was so boring. Like, I want to like really get into it. And then, of course that didn't work. And so now I love doing resourcing stuff. And I think it provides such rich context for even like future work. It's like, it's not a waste of time at all. And so a lot of times when I do presentations to like younger social workers or people who maybe are like, newer therapists or associates, it's like, my experience has taught me this, but I felt much like they probably do, which is like, we need to get to it and do an intervention right away that looks like this. But it's not true. But it's hard to trust that because, most of us that come in here are helpers and want to take the pain and want to, like, it's difficult for us to trust the process, even on our end, when we're learning how to do it. And so I'm just grateful that I've had enough time now that I feel really comfortable in that. Like, it doesn't make me nervous anymore, make me feel like I think it made me feel when I first started doing the work with people is like, I'm not doing enough for them right now. Like, look at how much pain they're in. Yeah. Like, I'm not doing enough right now. Like, what can I do right now? Like, I don't know if you've ever had that initial session where someone is just like suffering so much and like has suffered and they're looking to you like, I can't.
Can you help me?
Yeah, and you're like, yeah, okay, I hope so. Like, I'm gonna try. But I think that with experience, and you, as a therapist, you have a client like that, and then you have another client like that, and then you have another client like that, and you start to learn that, like, it's gonna be all right.
Yeah.
Like trust myself and trust them that it's gonna be all right. Because I think if you start freaking out,
right,
they're going to feel that, like, oh
absolutely.
Shit, like, oh man, I'm a mess. Like, even this therapist, which I had a therapist do this to me once, hopefully he's not watching. I don't remember his name, so I can't even call him out, but I scared the shit out of him because I was pregnant, just found out I was pregnant. My husband had been in recovery for quite some time, but I hadn't worked through it. I hadn't worked through, like, forgiving him, and, like, I was holding on to a lot of resentment. And so when I was pregnant, I was like, oh my God, like, what's going to happen? Like, what was I thinking? And probably a lot of hormones too. And I went into this therapist, man, dude, I was hysterical, like sobbing the entire session, a mess, like, and I could see the look of terror on his face. He's like, well, is there anything good about what's happening? I'm like, no!
Yeah.
No, you fucking idiot. It's not good. I was just like freaking out. And I remember, like, I didn't go back to him because I'm like, maybe I need a female therapist. Maybe it's that. I don't know. And what I did do is go back to Al-Anon, which really helped me actually a lot, because a lot of what I was holding was like really mine to work through. But man, I terrified him, which I could see why, of course. I look back and I'm like, that poor man. Like, I was so upset. Just so hysterical and totally lost and felt crazy, all the things. But yeah, he was afraid of me for sure. Or at least that's what it conveyed.
Sure.
So if you're out there, guy,
Yeah, hopefully you're okay.
Hopefully you're okay.
Still in the field, we need men.
Yeah, we need male therapists. Maybe like, you know, a hysterical pregnant woman wasn't like his niche.
Yeah, maybe not.
Like, I don't know what to do with my life.
Any last statements that you have? Well, we have a captive audience of like just encouragement to seek support if they're experiencing anything that you talked about today.
Yeah, I mean, I think the main theme that I will say is like, if you want to feel better, it is 100% possible. You don't have to be perfect. I don't want you coming in perfect. Like, and trust that like we've seen a lot. You're not gonna shock me, and like we're all human. Like, I'm a therapist, I'm human. I've been to therapy. I go to therapy. Been to Al-Anon. Take meds. Like, it's like taking time to remind yourself that like what you're going through is human, and that there's help out there, and it works. You really can feel better. It's totally possible, and you deserve to feel better. That's sometimes is it too. Like, do I even deserve it? And like the answer is yes.
Yeah, take the leap. Yeah. Well, thank you for being here again.
Yeah, thanks, Alan.
Yeah. Ladies and gentlemen, we break the cycle here every Thursday at 12:30 p.m. We will see you next week with another guest, Ashley Stafford, licensed clinical social worker, supervisor.
Yeah.
Yeah.
Thanks.
Cool. We'll see you guys next week. Take care.